So the number of new COVID-19 cases, that is starting to climb again inside Massachusetts public schools. Here to answer your questions about that is Dr. Vandana Madhavan, Clinical Director of Pediatric Infectious Disease at Mass General Hospital for Children. Nice to see you, Doctor.
Doctor, thanks for your time. So let's talk about this data from the state. It shows infections among students and teachers have jumped about 25% from March 23rd to March 30th. So bottom line here, let me ask you a couple of questions. What do you think? And is this a small bump or is this the start of a larger surge? What do you think?
So in terms of the second question, it's hard to know. We'll have to see, what the coming weeks show us in terms of numbers of cases. But it's not surprising that we are seeing a little bump. Right now, the vast majority of COVID-19 that's circulating is the BA.2 variant of Omicron that we know is more transmissible. It doesn't cause more serious disease as far as we know, but it definitely is more easily spread. And it's spreading in a situation where masks have become optional in school settings. Things have been opening up, and those people who had boosters in the fall are approaching the 6-month mark of their boosters. So we're seeing some waning immunity as well.
So, Doctor, we know the kids ages 5 to 11, they have the lowest vaccination rates of any age group that's currently eligible. Does that make elementary schools more vulnerable to outbreaks right now than other indoor locations like offices or restaurants?
I think it's definitely something we have to think about for a number of reasons. One, people spend more time in school than they do in a restaurant, as a patron. Certainly workers are there, but they're, more likely to be wearing masks potentially. And in the schools, in the elementary school setting, again, fewer people are vaccinated among the students, even if teachers are. And we have to think about office buildings might be newer, might have better ventilation systems in place. There's a lot of different considerations that we have to think about, with a lot of kids, more highly unvaccinated population in closer proximity for more hours of the day. So we can certainly see more, more spread in weeks to come if we see rates of COVID in the community that we're seeing right now.
Doctor, you just mentioned something a little bit ago I want to follow up on. Many public schools, as you mentioned, have dropped their mask mandates weeks ago. So do you think that administrators should reconsider that?
I think it's so multifactorial, thinking about what's going on in the community, not just the local community, that particular school, but the larger community, and then in Massachusetts. And also looking at, like the CDC levels have looked at not just rates, but also the impacts. What's the impact in terms of hospitalizations, ICU utilization, et cetera, and really looking at that overall picture to think about mask mandates, but also think about that if it's making people feel a little safer for a little while, bringing them back might not be such a bad thing for a short period of time. Knowing that if we dial back up, it doesn't mean we can't dial back down shortly thereafter.
Right.
All right, Doctor, thank you so much for your time today, and stay well.